Friends, we finally finished Rafa's case. Rafa was working in the United States and unfortunately had an accident where a chain hit him in the face, causing him to lose his three front teeth.
I had an accident while working. A chain hit me in the face. They were pulling a tractor that had gotten stuck with another one, and I was right there when the chain snapped and hit me in the face, and I lost my teeth.
With Rafa, we had an issue because he's coming from the United States, and the first thing we had to do was regulate the medical side, which is very important. And for this, Dr. Eduardo helped us a lot.
Implants go into the bone, so we require the human body to be as stable as possible. That involves everything from having excellent microcirculation to the gentleman being at a good metabolic level, such as glucose and blood pressure. So my job is, through lab studies, to detect exactly what the gentleman needs, if there's any systemic inflammation, and to stabilize him as best as possible so the surgeons or implantologists can do their best work. And we have greater success in the integration of the implant.
The big risk is placing an implant in a patient who isn't healthy or fit for one, performing surgery, and just hoping that implant works. Often, the surgeon can be the best. The assistant can be the best, the technique, the implant, the highest quality, but if the patient doesn't have proper health, that implant might not work. And as I'm telling you, it doesn't depend on the surgeon's skill. Therefore, our interest is for the patient to be healthy. Now, how many times have you heard that the eyes are the window to the body? And we have some very interesting news for you. We've seen that through the eyes is the only open window to observe blood microcirculation, and we've implemented in our clinic a check of the macula and the retina to be able to know how that blood microcirculation is doing. Now, Eduardo, tell us, what diseases can we detect through the macula and the retina that can indicate to us what the patient has, what the patient's ailments are?
Excellent, Doc. We are innovating, looking for a way to relate the patient's health status with retinographies. What does that mean? Mexico is #1 in diabetes worldwide, so the impact on microcirculation tells us a lot about what is wrong in the body. Retinography is a way to observe that microcirculation in a photograph. So in patients where we notice some cotton wool spots or vascular alterations, they can determine the success or failure of a procedure. So our job is to detect those patterns and provide treatment to the patient to stabilize them as best as possible so that we can have success with their implants in the long term.
So we've implemented this technique and will obviously be doing much more research. What we want is for us dentists to have more and more tools to be able to see a bit into the future and give the patient more certainty in their implant treatments and not be guessing if it'll work in this patient and not in that one, if this one will reject it and that one won't, because that uncertainty is terrible for patients and for dentists too. Now we're getting to the most important part. Rafa, it's been a long road.
You folded your laughter in the back of a drawer. Since the glass and the sirens, since the hospital floor, you practice saying I'm fine in the bathroom light, tracing the new thin scar like learning to write. But you can smile again, let it show, let it ache, my friend, every little tremble.
Why? Because when you first came to us, you were missing 3 teeth, and you told us something very important, something that really struck me. It was that you were having a hard time finding a job, that sometimes they'd shut you out a bit because, well, since he's missing teeth, they didn't really pay much attention to you.
I've had a really hard time since they fell out because sometimes people are they give you a lot of nicknames and you can't eat right.
Other things you'd mentioned to me as well were that when speaking, you had a lot of trouble pronouncing words and often didn't understand you well and communication was difficult, the aesthetics, you were embarrassed, you'd cover your mouth, and you went through orthodontics, Rafa. We had to align Rafa's teeth because when he arrived, we could have just made a prosthesis, honestly, but the perfection we sought, the angles, making sure everything was right, that the teeth weren't too big, that perfection forced us to do more for Rafa's bite. Therefore, he also went through orthodontics. It was a very interesting invisible orthodontics because he lives in the United States. He goes back and forth, so the monitoring was done through the phone. using that app we have where he can check in with his phone. It was a very well-managed process for Rafa. He did a great job. He arrived with his bite exactly how we wanted it. As a result, he was then a candidate for the placement of implants. And, well, it's time for Rafa to see his final teeth for the first time. So, Rafa, go ahead, please.
And yeah, you can smile again, even if it feels like breaking at the edges. Let it find its way across your face. You can smile again.
What do you think, Rafa?
Good.
How do you feel?
Very good.
Tell us.
They look like they used to.
They look like they used to, right?
Yes.
We also did a very interesting design where we suggested slightly longer teeth, and Rafa told us, no, my teeth were shorter. And thanks to digital technology, we can make them shorter or longer in a second through the digital process. We looked at them with Rafa and he liked them like this. And well, they really show. Let's see, a big smile. Look, you can't even tell because one of them, smile. This one is natural. And these are implants. This is an implant. This is natural. So the fact that you laugh and they all look natural, that's fantastic. And the whole team, Rafa, because you went through orthodontics, implants, surgeries, cleanings. Now you've gone to our prosthetics team. How do you feel? Tell us, how was your experience? Throughout this whole case,
I feel very good. Now I can finally smile. I'm not ashamed to smile anymore, and I can speak better. And they turned out well. Just like I had them, they turned out as I expected. And, well, I recommend people to come and visit you. Your work is very good, you're very professional, and above all, you take great care of the patient.
Thank you very much, my Rafa. Look, there's still some work to do with you. Down here, you have a space that needs to be repaired. It's a small pigmentation, but we already wanted to deliver the upper work and finish this aesthetic part. That bottom part will be resolved in the next few days. But, well, since Rafa comes and goes from the United States, we didn't want to waste any more of his time, and we wanted him to show off his teeth. This is still missing, and of course, right now, the interesting part is just beginning, which is the maintenance part, Rafa. Any treatment, any dental treatment, starts when I hand over the work to you. Because at home, you have to clean with dental floss we already showed you how to use. The inner dental floss, the maintenance, the diet. And watch out, a while ago we mentioned Dr. Eduardo, and he said it's very important for the patient to be healthy to be able to place the implants. But there's another very important thing. The patient has to stay healthy. Because if he's healthy today and gets implants, but if the day after tomorrow he neglects himself and, God forbid, gets diabetes or some problem that affects microcirculation, it could affect both his teeth and the implants. That's why it's always important to keep this idea in mind. Implants, crowns, veneers, nothing is forever, and even less so if the patient doesn't take care of both their health and their mouth. It's not enough, my Rafa, just to brush your teeth and floss for your implants to be okay. You have to exercise, eat well, keep your immune system good, keep your vitamin D at optimal levels, keep your bone healthy, and how? With microcirculation. Right? It's a whole system that's much more complex than it seems. But it gives me great pleasure. I'm glad you turned out so well. Let's see what all your daughters say now. How many daughters do you have?
$4.
And they live here in Mexico, right?
Yeah.
Well, that's awesome. They're going to meet their dad with his teeth again.
$4.
How cool, my Rafa. It's a great pleasure to be able to help you. So friends, remember, dentistry is beautiful. Why? Because besides the fact that we dentists can give patients back the ability to eat, which is vital, we also give back the smile. And the smile is one of the most important moments that a human being has to generate that serotonin, that dopamine, which is hard to generate. And many patients, when they have tooth loss, when they laugh and remember they have back teeth, in that moment, instead of laughing, it generates cortisol, it generates anxiety because they know they're being judged. So people live with depression, they live with anxiety, they live with a depressed immune system. Why? Because they don't have that serotonin. At its peak, dopamine is very important. Therefore, if you have any dental problem, believe me, even if it's just aesthetic and you think it's only aesthetic, it's functional because the body has to function well, you have to laugh, and you have to laugh with your mouth open and smile peacefully. Go to your dentist to get fixed up, to get things right. Go to someone who knows about dental implants and has mastered the technique and who checks your whole body perfectly. Well, so that you're healthy and they place the implants in a healthy body so the treatment lasts a long time. Don't forget to subscribe to the channel. Remember, leave a like, and we'll leave the before and after photos at the end and how the whole case went. Thank you very much. Congratulations, my Rafa.
Thank you.
And keep smiling. The end. Okay.
Yes, thank you.
Well, take care, guys. Bye.
But you can smile again. Let it show, let it ache, my friend. Every little tremble means you're learning how to bend. Yeah, you can smile again. Even if it feels like breaking at the edges, let it find its way across your face. You can smile again.